Hi, this is Dr. Ruscio, and today let's talk about if there's a connection between breast cancer and melatonin. A study was published in 2001 that noted that women who had retinal blindness had significantly less breast cancer than normal women. And this is a fairly remarkable finding because it was a pretty significant relationship that was noted that women who were blind had a significantly less incidence of breast cancer. And now, while we don't know exactly why this is, some researchers have speculated it is because women who are blind have better production of a hormone in your brain called melatonin. Now, melatonin is chiefly released when it starts to get darker. It's released by a gland in your brain called the pineal gland. Now, normally, as nighttime approaches and we're exposed to less light, the pineal gland in your brain makes melatonin, and melatonin helps make you sleepy. That's why melatonin is a natural medicine sometimes used for insomnia. And one of the things that will derange the production of melatonin is bright light. So we know that when, as nighttime approaches, if you have the lights on, full blast, and you're exposed to lots of light right up until you go to bed, you don't have as good of melatonin production as you could. So how does this tie in with breast cancer? Well, melatonin is also a very, very powerful antioxidant. And antioxidants, amongst other things, help protect against free radical damage, which can damage DNA and which may promote carcinogenesis or the cancer process. So while we don't know for sure if melatonin therapy will help with breast cancer, we do know one thing for sure, and that is that this study suggests moderately strongly that it is a good idea to allow your body to be exposed to light in the natural rhythm of the sun cycle, or the circadian cycle as it's called. So during the day you should be exposed to lots of light, lots of natural light, and then as nighttime approaches it's really important that you dim the lights and you let the artificial light somewhat mimic the natural light that would be occurring outside. This is why many in alternative medicine for a long time have been recommending that as it gets closer to night, in order to have good sleep hygiene, don't have the lights on full blast. Use a softer, lower watt bulb or dim the lights, because this will enable your body to make more melatonin, which will give you more restful sleep. And melatonin also is a very powerful antioxidant, which may have some protective effect against breast cancer. So this is Dr. Ruscio, and I hope you found this information helpful. Thanks.